statistical report produced by the European Monitoring Centre for Drugs and Drug Addiction provides us with a very useful information on the situation of the rapidly shifting drug market in Europe.
The European Drug Report provides an up-to-date analysis of Europe's drug situation. An interrelated set of products give a comprehensive overview of drug problems and responses to them in Europe today. These include our interactive statistical bulletin and country overviews presenting national data, as well as in-depth topical analysis provided in our web-based Perspectives on Drugs.
Overall, we can say that the use of the known plant-based drugs is quite stable and partly declining. Nevertheless, the problem is far from being solved. The stimulant market is in flux, with users switching easily from one substance to another. In addition, more and more new drugs are appearing on the licit and illicit markets.
At least 85 million Europeans have used an illicit drug at some point in their lives. This is around a quarter of Europe's adult population. Heroin and other opioids are still responsible for the greatest share of drug-related health problems.
It is estimated that at least 1.2 million people received treatment for illicit drugs in Europe in 2011. Opioid users are the largest group among those undergoing treatment. The long-term and chronic nature of heroin problems means that many of these users will remain in need of help for years to come. There is now a growing need to focus on the continuity of care, social reintegration, and also on building a consensus on what constitutes realistic short-term and long-term outcomes for this group.
For heroin, the latest data on demand for treatment in seizures show a downward trend.
Although its use is reported to be in decline, heroin trends need to be monitored continuously, as past experience has shown that drug problems often come in epidemic ways.
Cocaine, amphetamines and ecstasy are the most commonly used illicit stimulants in Europe.
Prevalence data illustrate the geographically divergent stimulant market in Europe, with cocaine, which is shown in green on the map, more prevalent in the south and west of Europe, and amphetamines, which is shown in blue, more common in central and northern countries, and ecstasy in red, the most prevalent stimulant in countries in the south and east.
This variation in stimulant consumption across Europe is supported in recent wastewater analysis, a new and complementary data source. Around 14.5 million Europeans have tried cocaine in their lifetime. Around 3.5 million have used it in the last year.
In recent years, we have seen a decreasing trend in indicators for both cocaine use and cocaine supply in Europe. In particular, we have seen a decrease in the seizures of the drug since the peak of 2006. This is likely due, at least partially, to organized crime groups changing their trafficking routes and also their methods. But what we have seen also is some large seizures in some countries in Eastern Europe, which is worrying considering the potential for diffusion of consumption in that part of the region.
Methamphetamine seizures, although still small in number and quantity, increased between 2002 and 2011. This suggests increased availability of the drug. The seizure of ecstasy tablets has been on the wane in Europe for a number of years, but recently there has been a rebound in the market. Ecstasy tablets and powders are now being seized with a much higher MDMA content.
Understanding trends in the use of synthetic stimulant drugs is complicated by the fact that these drugs are now often substituted for each other, with consumers making choices influenced by availability, price, and perceived quality.
We see now that domestic cultivation of herbal cannabis has spread to all countries in Europe, and this is reflected in the fact that the number of seizures of herbal cannabis has now overtaken, and for the first time in a long period, the number of seizures of resin.
An estimated 77 million European adults have tried cannabis in their lifetime. Around 20 million have used it in the last year. 3 million Europeans use cannabis on a daily or almost daily basis, representing around 1% of the European adult population.
In Europe, the numbers of clients entering treatment for the first time for cannabis problems increased by around 1/3, from an estimated 45,000 in 2006 to 60,000 in 2011. This makes cannabis now the most frequently mentioned main drug among first-time clients.
In 2012, 73 new psychoactive substances were officially notified via the EU early warning system. There is no sign of a slowing down in the number of new drugs being reported in Europe.
The unprecedented growth in the number, type and availability of new drugs has seen the phenomenon take on global significance. The rapid appearance of non-controlled alternatives to controlled drugs underlines the ability of the market to respond rapidly to the legal status of psychoactive substances.
Synthetic cannabinoids, chemicals which mimic the effects of cannabis, have now been reported in all European countries, normally found in herbal smoking mixtures. These products, which can be extremely potent, have also been found in samples of herbal cannabis and in mixtures containing other unrelated chemicals, such as tryptamines and cathinones.
Our analysis of the drug market is complicated by the emergence of new drugs, new psychoactive substances. These chemical or natural substances are not controlled under international law, but can pose a threat to public health.
The European Drug Report and its valuable information will serve as a reference for policymakers, specialists and practitioners working with drug-related issues.